Welcome to the ACS Technical Advisory Board podcast series, where we talk all things tech including data, cyber, AI, blockchain, and Internet of Things. Meet your host, Dr. David Cook, Vice President of the Australian Computer Society's Technical Boards. David is a technology advocate dedicated to advances and progression of computing and human-computer interaction. In today's episode, David will be talking with ACS Data Sharing Committee Vice Chair, Abhinav Jain. Join us as we discuss data sharing in health, integrated workforce management systems, as well as Abhinav's work with Aboriginal and Torres Strait Islanders.
Today, I'm talking with Abhinav Jain. Is Abhinav an analyst? Is he a data scientist? I'm not sure. But his current title is that he's the principal analyst at the Aboriginal and Torres Strait Islander Health at Gold Coast Health. And he's the Vice Chair of the ACS National Data Sharing Committee. Abhinav, welcome to the podcast.
Thank you.
You work specifically in areas of data sharing and health. What would you say is the biggest challenge in implementing analytics in health?
There are a lot of challenges in implementing analytics or using data for predictive analysis in healthcare. The major one being data silos. The data is being stored in so many different systems with so many different features that don't interact with each other, and that's the major challenge. But again, a lot of advancements are happening globally. For example, FHIR, the standards that are being worked on globally, so that way this data can be shared in a uniform way between different organizations. Then another challenge would be drifting away from the traditional ways of working. The traditional way of healthcare was based on human-centric approach, not based on taking data-centric decisions. But nowadays, a lot of decisions are being made using data. For example, to uh, reduce the waiting times in emergency departments, then identifying the patients with higher risk so that way they can be given better care first, and the list goes on.
Now, I want to talk to you about a particular project that I know you've been involved in, which is the IWFM, which is the Integrated Workforce Management System. This is for an enormous project, 100,000 health professionals, and you've implemented a rostering tool that combines traditional ways, change management, future change. What have been the biggest challenges in terms of that? Tell us about that project.
I feel implementing or being a part of the IWFM team or implementing that project or product, that's been one of the best projects I've ever worked in, because it's directly impacting over 100,000 Queenslanders or healthcare professionals in Queensland. And the biggest challenge was uh, drifting or moving away from traditional ways of doing things. How it was happening was still paper-based rosters, and again, the system not interacting with the payroll solution. So it's one of the biggest wins for us in healthcare industry, where everything is happening through an integrated system that aligns with payroll. And I feel it has been a big journey. So in those course of 4 months, I finished about 216 tasks that was around future state to current state, understanding how they are rostering now, what would they be needing in the future, and again providing them hypercare after go live. So that was all a great challenge. And again, from training to interacting with nursing managers, the team who works on the ground, understanding what they need in the new tool, and again giving enhancements for or requesting enhancements for the future improvisation. That were one of that was all what was included during the implementation of that project.
Now, I love hearing about the good news side of data sharing. It's wonderful to hear that, I mean, just the sheer size of that project, 100,000 healthcare workers, that's a tremendous effort. I'm aware of some of your other work, and I wanted to touch on one of your big parts in the role is working with Aboriginal and Torres Strait Islanders. And you gave me some stats a little bit before we started this, telling me about the fact that you've had zero suicidal deaths in the last 2 years for First Nations people. You've had a zero waiting for Category 1 and 2 surgery on their waiting list. And you've had a 100% success in completion of an oral health program for over 2 years. They are amazing. I mean, truly amazing statistics. And most of this is generated by a data sharing approach. Tell us about why you've been able to do what many other people would be jealous of, which is to get success rates in this terms. What are you doing right?
This happened when we started working on a legislative around health equity that's uh, working on some of the key issues for First Nations health and improving those sectors. And that started about 2 or 3 years ago. And my role in Gold Coast Health was to co author the board report, which touched on a lot of pressing issues, to name a few: mental health, low birth weight babies, elective surgery wait lists, then a lot of key performance measures that were agreed in the health equity. And again, that helped me present the same report to uh, executives in Gold Coast Health and the board. And the bigger aim was that to help everyone realize that health equity is everyone's business. And through with the power of data, I was able to show the differentiation between non First Nations and First Nations health. And again, what are the steps we can take to improve or take a proactive approach. And again, having all these executives or partners or allies from a few other healthcare organizations in Southeast Queensland, it gave me an opportunity to present how we are tracking against our targets and how we can improvise or partner with them.
Yeah. Look, I wanted to touch on, you used the term FHIR a little bit earlier, which for those people who don't know is fast healthcare interoperability resources. And it is about interoperability, isn't it? It's about making different things from different areas work together to form a complete map on how we do things. I'm aware that whilst you've had great success in Gold Coast, what does it look like compared to, say, broader in terms of all of Queensland or all of Australia? Because your success rates are above some of the other parts of Australia. And what needs to change in these other areas? What if you could just tell me two key things that need to change? What would they be?
Two things that we need to still change. That's again working on the data silos of how we can use our FHIR or different frameworks that are uh, being built up or worked upon right now, so that way we can integrate data from different organizations or systems and use them together. Second one would be, again, moving towards more data centric decisions. I wouldn't say relying on data to make a decision, but again, using all the other factors along with the data, historical data, predictive analysis of what the future would lie in. And again, there's a lot that can be done with the power of data, using it to provide the best patient centric solutions. And again, I would like to share one of the biggest achievements we have achieved in Southeast Queensland. That's not Gold Coast Health, but all the organizations in Southeast Queensland. We all have partnered and agreed to this interesting data sharing, where all the organizations will share their data in relation to First Nations health. And that way we can have a combined solution, a data driven analytic solution like a dashboard that will tell us a true picture of health equity for Southeast Queensland and not just Gold Coast Health. And again, a lot of challenges have been a part of this process, being around legal or ethical use of data. And again, each aspect or challenge have been looked at very carefully, and I feel this is one of the it's still in process, and I can speak to it because I'm in the working group for that piece of work where all the organizations are working together to achieve this thing in the future.
Abhinav Jain, thank you for your time today.
Thank you, David.
To find out more about how the ACS is powering Australia's technology brilliance, visit us at our website, Facebook or LinkedIn. Want to get involved with the ACS technical boards? Email us at tab@acs.org.au and tell us a bit about yourself. Join us for more thought leadership, ideas and information through our other podcasts on the ACS YouTube, Facebook or on LinkedIn.